Most patients that actually we see in Singapore, they actually don't really have dry skin.
Oh.
They actually have dehydrated skin.
Welcome to We Need to Talk About This, and today we need to talk about skin.
That's right. Now, my first question, I have to say, is about showers. I really want to know if you have long showers, long hot showers, and I'm not just saying a tiny bit hot, I'm talking maximum heat showers.
Look, I do. I love hot showers and I love long showers. It just relaxes me. It feels wonderful. How about you?
I totally agree. I have long, really, really hot showers, so much so by the time I open the door, when I get out of the shower, it's like smoke.
Oh, no. I'm looking for steam.
We have Dr. Shirley here with us, and I believe she's gonna disagree. Dr. Shirley, what do you think?
So everything is all about balance, but Mike, how long do you shower normally?
Usually I try to do like a 3-minute shower, 3-minute shower, quick. But sometimes if I'm having a bad day, I might be in there 10 minutes.
That's not bad. How about you,
My
Catherine?
regular showers are 10 minutes.
Okay, regular, wow.
Yeah, so long showers might be a bit longer than...
Okay.
Okay, so hot showers between 5 to 7 minutes. So that 10-minute shower is going to be a bit too long for you.
Right.
If you do it too long, it can strip the skin of its natural oil. So the ideal temperature, usually about 37 to 40, is like lukewarm temperature. And when you come out of the shower, try to moisturize immediately.
Is dry skin and dehydrated skin the same thing, or?
No.
Oh.
Ah.
Okay.
Do you know the difference?
No.
But I guess what we have here is gonna
Help us understand.
Yeah.
Okay.
Dry skin is what we call as a skin type. It's
Okay.
like oily, normal, or combination, you
Right.
know? Whereas dehydrated skin is more like a skin condition. So we have like plums
Yep.
with the protective barrier that is already stripped off. Where
where
was
is
it?
it? Yeah, right
Yes.
there, okay.
So it's something like this. So when this happens to your skin, the water just kind of like evaporates because there's nothing that
Okay.
helps to prevent the water loss.
That looks painful.
Yeah.
It is.
Okay.
But when you have dehydrated skin, it's more like when you don't have enough water in the skin. Okay, so most patients that actually we see in Singapore, they actually don't really have dry skin.
Oh.
They actually have dehydrated skin.
So does Cat
okay.
look like this?
Not look like a prune.
This is like
like
prune,
a-
which is
yeah.
like
Okay, what is it?
dehydrated.
Right, prune, right?
So this is what happened when we actually inject some water.
So then
The
they
prune-
look a lot nicer.
Yeah.
Okay, so now that we know the difference between dry and dehydrated skin, how do we treat it? Are there home remedies?
There are.
What do you do with the home remedies?
You can apply it where you feel there's
Yeah.
dryness, sometimes
Okay.
the hands, sometimes the face, okay? Manuka honey helps to attract water. It also helps to smoothen the skin texture.
Okay.
Okay, how long would you do it for?
I probably put like less than about half an hour or
Okay.
so.
Oh.
Yeah. We have olive oil, okay? It's better if you use the extra virgin olive oil, okay? It helps to like, gives you like a protective barrier.
Cool.
Coconut oil is something that you can apply during bedtime. It also hydrates.
Don't know how your sheets will
Boy.
feel.
Exactly.
Can we do something that's a little less oily but works?
Definitely. You can always get your doctor to tell you first
Yeah.
if you do have dry skin,
Yeah.
dehydrated skin, because people with oily skin can also have dehydrated skin.
Because I do get oily skin, but sometimes it's very dry around here and stuff like
Yeah.
that.
Do you moisturize?
Be honest.
I don't, man. I bought a bunch of moisturizer, but I've never used it for my face.
But you should. But of course, there's things that you need to look out for when you find moisturizer.
Okay.
You need to look out for 3 ingredients: occlusive, humectant, as well as emollient. Occlusive means basically it helps to occlude, okay? So it does form a protective barrier on top of your skin.
Okay.
And then for humectant is something that can attract water molecules.
Okay.
Things like glycerol or hyaluronic acid. Have you heard about HA
Yes,
before?
yes.
Yeah. HA can attract about 1,000 times of water of its
Oh.
mass. Yeah.
Okay.
So you need HA, and we actually have it in our body. It's just that when we age, we lose HA.
What was the third ingredient?
It's called emollient.
Yeah?
So what it does actually is fill in the defects of the skin. So when you have dry skin, usually you have issues with like the intercellular lipid. So the
Okay.
fat tissue that usually connect the cells, they are not there. So with emollient, it actually fill in all these crevices and bringing all the tissues together.
Oh, okay. All right. Nice.
So what do we have here? We have some creams.
This is what we call as serum. For serum, usually you have a very high concentrations of the active ingredient. Okay. So this one actually has HA as well as glycerol. So which are the humectant. So it
Okay.
helps to attract water.
Okay.
Yeah. And then you have a lotion that contains 15% glycerol. So it's also a pure hydrator. They have a little less active ingredient, but they are not sticky. So the third one is more like a cream.
Okay.
So it's usually more thick. It has HA as well as squalene. It helps to attract water, but also helps to kind of like seal the skin. Okay, so lock the moisture in.
And the last, but I think certainly not the least,
Yes.
this looks thick and...
This is actually a really good eye cream.
Well, there
it
you
has
go.
glycerol and it also has caffeine. So if you have fine lines and dark eye circle, you can use this.
The last one looks very painful.
These are the things that we can do in the clinic. If these things have failed, or you don't want to do all these things
'Cause it's a lot of
every
work,
single
yeah.
day, then you can do this. They are basically injectable moisturizer.
Wow.
So we actually inject it underneath the skin. It's not painful because we do put numbing cream first, but it is like a really, really good hydrating agent.
And how long does that last for?
Usually about 6 to 12 months.
Oh, wow.
So what's your last bit of advice for people with dry or dehydrated skin?
Always remember to moisturize. Don't shower with hot water for very, very long, okay? Drink more water.
All right, guys, thank you so much for watching this episode, and thank you so much to Dr. Shirley. You've been great.
Thank you so much.
We'll catch you next time on
We Need to Talk About This. If you enjoyed this online clip, don't forget to check out our main series, Let's Talk About Health on Channel 5 and MeWatch.